Do you ever feel sudden, painful stiffness in your jaw or neck that makes it hard to open your mouth or swallow? Imagine trying to eat your favorite sandwich, but your jaw locks up. It's scary, right? That's one of the key signs of tetanus, also known as lockjaw. It's not caused by a virus like the flu, but by germs that can sneak into your body through even a tiny cut. Unlike colds, tetanus isn't contagious. You can't catch it from someone else, but it can be life-threatening if not prevented. Think of it like a silent trap. It starts small, but can take over your muscles fast. Have you ever stepped on a rusty nail and not cleaned the wound well? That's when you might be at risk. So what actually causes tetanus? It's caused by a type of bacteria called Clostridium tetani. These bugs are sneaky. They live in soil dust and even animal poop. They can't move on their own, but they travel by getting into your body through cuts, burns, or wounds. Here's a real-life example. Say you're gardening barefoot and step on a dirty nail. If that nail has soil on it, the bacteria might enter your body through the wound. Once inside, the bacteria don't spread through your blood, they stay in the wound, but release a dangerous poison toxin that travels to your nerves. This toxin messes up your nervous system and makes your muscles tighten up uncontrollably. It's not about being dirty, but about whether a deep wound was exposed to bacteria and not properly cleaned. How would you know if you have tetanus? Let's play detective. Early signs often include a tight feeling in your jaw. You can't smile or chew properly, hence lockjaw. Then comes neck stiffness, making it hard to turn your head. Imagine trying to look over your shoulder while driving, but your neck just won't budge. Other clues: painful muscle spasms, especially when you're startled by light, sound, or touch. Picture this: you're in a quiet room, someone turns on a bright light, and suddenly your whole body jerks in pain. That's how sensitive you can become. In serious cases, muscle spasms can affect breathing, like your chest muscles freeze up when trying to take a deep breath. Fever, sweating, and fast heartbeats are common too. Remember, no fever or cough, but major muscle drama. Now, do doctors need fancy machines to find tetanus? No, they can't test your blood for it. Diagnosis is mostly based on your symptoms and medical history. Your doctor will ask any recent wounds. Were you vaccinated? For example, if a construction worker comes in with jaw stiffness after a nail puncture and hasn't had a booster in 15 years, that's a red flag. Treatment isn't about killing the bacteria alone. First, they clean the wound, thoroughly removing any dirt or dead tissue. Then they give tetanus immune globulin TIG, which acts like emergency backup antibodies to fight the poison. Muscle relaxers and sedatives help control painful spasms. You might need to stay in the hospital, sometimes in ICU, until your body calms down. Antibiotics are given to kill the bacteria. And if breathing is affected, a breathing machine, ventilator, may be needed. It's intense, but catching it early helps a lot. Here's the good news: tetanus is preventable. And the hero, the tetanus vaccine. Think of it like armor for your body. Most kids get it as part of the DTaP shot, with diphtheria and whooping cough. As adults, we need a booster every 10 years, called TD or Tdap. Have you had a booster in the last decade? If not, a simple shot can protect you. Also, proper wound care is key. If you cut yourself with a dirty object, wash it right away with soap and water, use antiseptic, and cover it. If it's deep or dirty, like from a rusty tool, visit a clinic. They might give you a tetanus shot, even if you're up to date. Better safe than sorry. Pregnant women also get Tdap to protect their newborns. It's not just a shot, it's long-term peace of mind. What's new in the fight against tetani? Scientists are working on better vaccines that last longer and cause fewer side effects. Some are testing DNA-based vaccines. Imagine training your body to fight tetanus using genetic instructions instead of weakened germs. Others are improving fast diagnostic tools. Right now, diagnosis is based on symptoms, but researchers are trying to develop a test to detect the toxin in blood faster. In remote areas, new needle-free vaccine patches are being studied, like a Band-Aid that delivers the vaccine through the skin. Cool, right? Also, global health programs are focusing on making boosters more accessible, especially in rural regions where tetanus still affects many. Every advance brings us closer to eliminating this painful disease for good.